guys, Dr. Sam here with Omega Functional Health. So I just want to shoot a quick video because I'm getting a lot of questions from a lot of our new patients. It's just, Doc, why does my knee hurt? So I just want to go over some of the basic knee anatomy that we look for when people come in with chronic knee pain. And so one of the very first things that we look for when somebody comes in with knee issues is the patella or the kneecap, specifically how it attaches both below and above the knee into the quad. And why we look up in the quad, why it's really important is because of this muscle up here called your vastus medialis. So your vastus medialis, when it gets weak, that patella starts to track improperly. And what happens, it gets out of its groove and it starts to slide over on the outside. And so when it starts to track out of its groove, that's when it starts to lay down calcium in the tendon, and it gets that gravelly, just really uncomfortable feeling. And that's where it hurts when you bend your knee, especially if you're like squatting down to the ground, and it just feels like it's not as smooth as it should be. So that's one of the things that we look for, is that weakness of the muscle and how that kneecap is tracking. The other two things that we look for on the front of the knee is the LCL on the outside and the lateral meniscus. And on the inside, we look at the MCL and the medial meniscus. So why these two places are really important, because these are the shock absorbers of the knee. So if your knee aches, if it hurts after you've been standing on it for a long period of time, usually these are going to be involved, and they take a long time to heal because of how their blood supply is. They have very poor blood supply, so they have very poor vascularization. It takes a long time for them to heal. One of the cool things that we use in the office is called shockwave therapy, which helps to improve blood flow, especially to these areas. So we'll often see patients get really quick results with that because we're improving blood flow into those two spots. So now let's check out the back of the knee. All right, so when we're looking at the back of the knee, a couple of places that we look for is going to be the attachment points of both the calf or the gastroc that attaches, it actually connects all the way above the knee, helps to bend the knee. We look at the hamstring muscles that attach and really intersect with the gastroc below the knee. But one of the most overlooked muscles that we see with chronic knee pain is what's called your popliteus. So your popliteus is responsible for locking and unlocking the knee, and it connects on the back side here. Almost like everybody that comes in has this problem, and it's missed by almost every doctor that they've been to. So what's really important about the popliteus, since it locks and unlocks the knee, is it can mirror or mimic meniscus injuries on the front of the knee. But if your knee constantly feels like it's going to give out, then that's usually involved with this muscle here. So once we get it activated again, your knee actually has some strength and fluidity to it, and you're out of pain. So if you're curious about what we do for chronic knee pain, then check out our other video on treatment options or schedule a complimentary consultation. Let's find out what's going on with you and find out how we can help.